representing our country in Russia, but U.S. Olympians still don't get a free pass from Uncle Sam should they win. The U.S. Olympic Committee awards cash prizes to the athletes, $25 grand for gold, $15,000 for a silver, and $10,000 for bronze. But the IRS considers that taxable income. Yes, they do. Some lawmakers, though, are trying to change that. Well, that's it for this special holiday edition of Nightly Business Report. I'm Tyler Matheson. Thanks so much for watching. We'll see you back here tomorrow night.
Nightly Business Report has been brought to you in part by
TheStreet.com. Founded by Jim Cramer, TheStreet.com is an independent source for stock market analysis. Cramer's Action Alerts Plus service is home to his multi-million-dollar portfolio. You can learn more at TheStreet.com/NBR.
Programs on MPT are made possible by our members and the following.
Hi, I'm David Schaffnacher. Are you tired of seeing me on MPT? Well, I know these guys are, but in order to see less of me, you need to give more to MPT. So become a member today. Thank you.
Tonight on Direct Connection, has all the shoveling gotten to your back? We will have expert advice on preventing and treating back pain with your phone calls tonight at 7:30 on MPT.
Public Square on MPT. It's TV worth watching.
On the next Maryland Farm and Harvest, 52 countries around the world are sold on jeans made right here in Maryland. And we're not talking blue jeans.
We have exported embryos to 9 different countries.
It's all right here on Maryland Farm and Harvest.
Tuesday night at 7 on MPT.
We came from Puerto Rico. We moved here to Bethlehem, Pennsylvania when I was 4 years old. I'd come from a very hardworking blue-collar family. My dad was diagnosed with leukemia. I couldn't continue my education and had to focus more on holding a full-time job so I could help pay the bills and support my family. I'm a very curious person. One night I was watching an episode of Nova about genetics and evolution. Fireworks went off in my head thinking, oh yeah, that's something I could do. Why can't I go out and change the world? I decided to go back to school so I could study evolutionary genetics. It looks like I'm going to be able to pay the bills while going into something where I could achieve my dreams. PBS presented me with an idea that had never occurred to me before. I've never felt such a purpose, and now all I do is dream big.
This is an animal with attitude. Honey badgers don't bluff. They may be the bravest act in the African bush, and also the smartest.
He outwitted us each time.
They're masters of mayhem and capable of anything.
Wednesday night at 8 on MPT.
See the legends of 70 Soul live in concert on Saturday, June 14th at the Modell Performing Arts Center at the Lyric. Don't miss performances by Russell Tompkins' New Stylistics, The Shy Lights, Harold Melvin's Blue Notes, and Cuba Gooding Sr. For tickets and more information, please call 1-800-222-1292 or visit mpt.org/events.
Programs on MPT are made possible by our members and the following.
Chesapeake Employers Insurance helps keep Maryland workplaces safe because
at the end of every workday, someone's waiting for your safe return.
More information is available with your local agent or online.
Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody. Thanks for tuning in for Direct Connection. Our focus tonight is a common medical complaint that at one time or another will affect up to 80% of the population. And a winter of above average snowfall and above average shoveling has not been helping. In the studio now for our Your Health segment, is Dr. Stephen Ludwig, professor of orthopedics at the University of Maryland School of Medicine and orthopedic surgeon at the University of Maryland Medical Center. Doctor, thank you for being with us.
Thanks for having me.
Obviously, we're talking about back pain and a lot of complaints, and shoveling is not particularly good for that, I guess.
No, I mean, especially now we've been sort of inundated with snow, and we've had a lot of complaints of people that have these acute back attacks, and the good news is that most of them are sort of self-limiting. Most of them go away. And you just need a little rest and Mother Nature to help sort of coach it along.
What typically happens in that it's a lower back concern, and it's more about the muscle than the spine itself?
Yeah, well, it's a multifactorial sort of situation. It's a combination of bad technique, perhaps when you're shoveling, the muscles sort of get overused. Sometimes the disc spaces can get irritated. Sometimes the joints that control the motion in the back get irritated. It's a combination of a whole sort of cadre of things that can set off the problem.
And it's the sort of thing where you know immediately something tenses up?
Well, sometimes it does, but sometimes it can hit you the next day, several hours later. It's not uncommon for people to call the office after a horrible shoveling event or some sort of low-grade trauma or micro-trauma or repetitive type of activity, and it doesn't hit them for a few days later with the complaints of back problems.
What do we do when back pain crops up?
Yeah.
What's the first line of treatment? You know, is it the heating pad or is it ice?
Yeah, it's different for everybody, but what we tell people is we reassure them. I think that's probably the most important thing, that most of these problems are self-limiting. Most of the problems will go away by themselves. Typically, we treat it with some anti-inflammatory medications, sometimes little muscle relaxants if people are really, really bent over and they're having a lot of muscle spasms, to your point from before. We show them some exercises to do to get their back stretched out, and typically with a little bit of time, activity modification, they get better.
Let's talk about the role of exercise for a minute in both preventing and treating back pain. Is there an exercise program? Do people who are in generally good shape have fewer back issues or not?
It's a great question. So people, you would think that people that are very fit would have less back problems. The reality check is that we see athletes, the weekend warrior, we see professional athletes, we see college athletes that are in spectacular shape and they have back problems. They may have muscle problems from overuse, from an injury related to their sports. They may have a disc problems where they tear their disc and they have numbness or tingling or nerve-related problems. But the reality check is back pain is seen by all folks, people that are in great shape and people that are not in such great shape.
Let me remind our viewers, if you have a question about your back and how to make it feel better, give us a call. We'll have the number up on the screen. You can also tweet a question. Our Twitter address is @MPT News. So you're a surgeon and you do procedures all day. What's new in the surgical realm?
Well, the good news is that most people that see me do not need an operation. That's the good news. It's a very rare bird that requires surgery. When problems become incapacitating for people, when problems become life-threatening in certain circumstances, when they may be losing function, people may require surgical intervention. There are a lot of new techniques that are on the forefront that we're pioneering at University of Maryland. We try and do things through smaller approaches now. We call them minimally invasive approaches to reduce some of the damages that may occur as a result of sort of the larger or open procedures that can cause some morbidity, some discomfort, some pain, reduction in return to work and activities.
Back surgery has a little bit of a reputation of not always being effective, of not being 100% effective and people continuing to have discomfort. Maybe it depends on what the initial complaint was. Is that the case in your experience, or what do you think?
Well, I think, to your point, when surgery is done for the right indication, with the right patient, by the right people doing it, surgery can be very effective. It's super important that we marry up a patient's symptomatology or the problems with their examination to their advanced imaging studies. The problem in life is that as we all get older, people will have a lot of changes on their x-rays, a lot of wear and tear, just like getting gray hair. And the problem is, as we talked about initially, most folks don't need any surgery at all. They just need reassurance, some non-operative management, and things will get better. However, if neurologic problems are occurring, patients may require surgical intervention.
Let's take some phone calls. This is Tom in Prince George's County. Tom, thanks for calling. Go ahead.
Doctor, I'd like to ask you a question about spinal stenosis, especially in the aging. Is there anything that can be done to take care of that problem or to alleviate it?
Tom, thanks for the call. And by stenosis, it's a narrowing?
Exactly. So stenosis occurs as a result typically from advanced degeneration, arthritis as we get older. The area where the nerves are traveling through the spine, whether it's in the neck or in the lower back area, causes, as the viewer or as the caller in discussed, spinal stenosis or narrowing. The newer techniques can open up the areas for the nerve roots, relieve the pressure on the nerves. It can be a life changer. It's some of the best procedures we can do to help improve a patient's quality of life.
What can be done in those cases short of surgery?
Well, there are a lot of non-operative processes that can be helpful. Therapy, as you discussed, or getting active and getting into a little better physical shape. Anti-inflammatory medications, sometimes shots of steroids can be helpful as well.
Let's talk to Pat in Harford County. Pat, thanks for calling. Go ahead.
Yes. I have a pinched nerve in my neck that is going down my shoulder and my arm, and it's caused my thumb to get numb now. Anything that can be helpful without having to get shots or whatever?
Pat, thanks very much.
Yeah, that's a good question as well. You know, what I counsel most folks when they're having the type of pain, and Pat was describing a neurologic problem traveling down, I think, her arm. Certainly exercises can be helpful at strengthening the muscles around the nerves and around the disc spaces to help reduce some of their discomfort. Anti-inflammatory medications can be helpful unless there's some contraindication or problem that people have with anti-inflammatory medications. But once again, most of these problems, when you're not losing function, are self-limiting and get better on their own.
What would you do as a workup, the next step when somebody comes in with complaints like that? Is it an MRI, CT scan, X-ray? Where do you go first?
Yeah, that's a good question. So what Pat was describing was a neurologic process, you know, a pain that was from her neck, I believe, traveling down the arm. To me, it sounds like it's a pinched nerve. It may be stenosis. Typically, if somebody has neurologic problems, we'll get an MRI scan to answer your question.
Okay. And an X-ray could pick up if if there were some more visible issues with actual bone structure.
Yeah, certainly the first line of sort of radiographs are just plain imaging studies that we can get in the office. But when there's a concern for a neurologic event like Pat was describing, you know, if her quality of life is affected once again, or functionality, or neurologic exam, we won't hesitate to get an MRI scan to get some more advanced imaging and understanding of the problem.
Out to Baltimore County, Alice on the line. Alice, thanks for calling. You're on.
Hi.
Hi.
I just got a couple questions. I had an MRI done, and I've been to two specialists, and they both told me I've got spinal stenosis, and that I do have to have surgery. It comes and goes with the pain, but lately I haven't had any pain with it. I get a little achiness in my shoulders and in my neck. I'm just wondering, you know, how, if I do have to get this right away or if I can wait.
You're not in a hurry, it sounds like.
No, I'm not. I'm really not having that much pain with it, and I'm kind of, hesitant, and I'm worried about the insurance and what it's going to cost down the road, too, if I wait.
Right.
You know?
Well, good luck. We'll get you an answer on the air. Thanks for the call.
Thank you.
So the answer to Alice's question is that the symptoms will wax and wane, and it's not because the structure or the architecture of the stenosis is changing. It's just the natural history, and I don't have an answer for you, frankly, why the symptoms will come and go. We do know that the natural history of somebody with what Alice was describing is that it will come and go. The problem is if it stays on and it gets more progressive, more severe, more intolerable, then we may need to get more aggressive.
What should a patient expect from that kind of surgical procedure? You're spending a night or two? It's a long operation, a short operation? I have no idea.
Right. It really depends upon the pathology, the number of levels involved, whether or not it's a neck problem or a low back problem, whether or not they have a more complex spinal problem requiring perhaps a fusion procedure. That really will dictate the length of stay in the hospital, their outcomes, the complication rates, things like that.
About a quarter of your work, you told me, is in shock trauma, dealing with emergencies as opposed to elective procedures. How's that different?
So it's a completely different animal. I mean, these are people that are fine today, and then they have this tremendous traumatic injury, and they have it can be a life-altering problem. You can walk one day and you can be completely paralyzed, minutes later after your injury. There are very, very rare problems from an elective perspective that can cause a progressive decline in neurologic function. Some problems in their neck, some problems with tumors that can cause it, but traumatic injuries are a completely different animal.
Let's go out to Prince George's County. This is Dee. Dee, thanks for calling. Go ahead.
Hi, thanks, guys. Thanks for taking my call.
Absolutely.
For the doctor. I am very fairly healthy. I mean, I work out at least 4 or 5 times a week. I'm 52 years old, and my lower back, it seems to wake up with pain there. Now, I do a little yoga, and the yoga seems to pull it out, but the next day is the same thing. My lower back, sometimes it comes up to my lower side of right under my muscle on my left arm. I have no idea. And my second question is, what would determine whether or not I needed an MRI? Does it sound like something that I would need to have an MRI concern about?
Dee, thanks very much. Good luck.
So what we tell people like Dee is that, once again, that's part of the natural history of people that have benign low-grade low back pain, and I'm not minimizing the symptoms. They could be
if it's your back, it's a big deal.
Absolutely. Right. But some of the red flags that we get concerned about, to answer Dee's question, when do we get an MRI scan? So if the pain goes on for a very chronic period of time and is escalating, that's a concern. I may consider getting an MRI scan. If somebody is having neurologic problems or weakness in their legs, problems with their bowel bladder habits, that is a concern to me. I'll get an MRI scan. People that have a history of tumors, once again, that may be a concerning factor. People can have tumors that involve their spine that can spread from other areas. That's concerning. Infections, trauma, those are all reasons to get a more advanced imaging study like an MRI.
When I hear about all of her exercise, you wonder if maybe there's something in there that's doing damage and you don't know about it.
Yeah, I mean, I think sometimes people can overdo it too. Sometimes people have poor form. Sometimes people can be misguided. They need to, maybe go through a good regimented physical therapy program with a good physical therapist, and sometimes finding that right person can be challenging.
We're not set up here to demonstrate anything, but is there anything that you prescribe to patients or have seen prescribed, basic exercises that really help, or conversely something that's going to kill your back?
Yeah, I think people ask me this all the time. I tell them that I'm a fan of non-impact aerobics, so elliptical machines, swimming, biking. I think those are all fantastic for your low back. Core stabilization. In the past, when everybody was younger, they would do crunches and work on their abs and get their core really strong to compensate for a low back problem. We do core differently now. I tell people to do plank exercises where they're just sort of holding instead of doing crunching exercises. These are all things that you can pick up online or talk to a physical therapist, and in addition to a strengthening and a stretching program.
Anne Arundel County, Diane on the line. Diane, thanks for the call. Go ahead.
Hi, thanks for taking my call.
Sure.
I was, about 3 weeks ago, I was diagnosed with sciatic pain. It's gotten better, but my left leg is still a little numb, and I have this pain in my lower hip around to my lower front. And I'm a little tired of lying down, and I just wondered if there was any exercise program that I could do. I have been doing water aerobics and wondered if I could go back and do that.
Diane, thanks for the phone call.
So that's a very common problem, sciatica, that Diane is
that
describing. Sciatica is a radiation of pain down a very specific distribution that's associated with a nerve root. So pain in the back from a pinching of the nerve, causing pain down into the buttocks, down the leg, into the foot. I think she was describing some numbness and tingling. What I could reassure Diane is that the pain typically will go away first. The strength and endurance will come back second. The numbness and tingling can take a long time to go away if we're just going to watch this conservatively. Typically a flexion, what we call a flexion-based physical therapy program, where your body is sort of moved forward as opposed to sort of extended, and doing exercises where you're sort of forward flexed are better than somebody that is an extension, because the area for the nerves when you're leaning backwards is more extreme, or there's more pinching. So a forward flex problem, I love aqua therapy. I think that's spectacular.
Yeah. I wonder if orthopedic surgeons who spend a lot of time standing up have less trouble with their backs than people like TV hosts who spend a lot of time sitting behind a desk.
I don't know. It's a good question. I have a lot of friends, and there are papers that are written about ergonomic problems in surgeons. So I think the problem is
bend over a
ubiquitous.
lot.
You're
Right.
bent over, you're leaning over for long periods of time in long
Right.
cases. Absolutely.
Let's take another call. Is this Diane in Baltimore County? Did we do that before? Let's try it. Hello, you're on. Go ahead. Is this Diane? Oh, my bad. I wanted to ask about obesity. As Americans get bigger as a society, does that feed into this? Do you see more problems in larger people?
I could tell you anecdotally, people that are larger with a higher BMI will typically have more back-related problems. Problems with if they require surgery, their complication rates are exponentially higher compared to non-obese people. There are a lot of studies that suggest that the incidence of back pain in obese versus non-obese people, about the same. However, I could tell you, it seems as though the tendency is leaning towards, if you have a higher BMI, you may have more musculoskeletal problems like back pain.
Let's talk to Michael in Virginia. Michael, thanks for the call. Go ahead.
Hi, doctor. My question is, I have an MRI, and I have problems with my L4, L5, and L7 back disc. And one morning I can be fine, and the next morning I can't even get out of bed. Where my wife had to actually pick me up in a standing position. I just want to know what determines whether or not you have surgery or not.
Thanks for the call.
So once again, I think to Michael's point, when it begins to become cumbersome for his lifestyle, when it affects his quality of life, when it begins to affect his level of function, when he can't tolerate the pain anymore, I think it's reasonable to get evaluated by a physician that specializes in spine.
As we get older, do we all develop some of these issues?
Well, the interesting part about it is that radiographically we're all going to have the changes associated with degeneration, spinal stenosis. In fact, when you reach your 70s or 80s, probably about 80 to 90% of people, based on their advanced imaging study, their MRI scan, will have radiographic evidence of spinal stenosis.
Wow.
But there are people that are copers and are non-copers. So some people can
Do they all
tolerate
have
it.
symptoms? I mean, if you're seeing it on the picture...
That's my point. People will have the radiographic changes, but they'll have absolutely no symptoms. And we can't explain it. It's like looking for the Holy Grail. We don't know why. The reality is that there are certain people that can't tolerate it, become symptomatic, and they really go downhill, and that's when we intervene.
Are there some people with good-looking MRIs, perfect radiographs, who nonetheless have back issues?
Absolutely. So that's the other end of the spectrum, too. And that's the conundrum. We'll see people that have horrible back problems and pain, and once again, it could be multifactorial, as we talked about initially, and their advanced imaging studies looks pristine. And that it's upsetting to the patients because they expect there to be some sort of pain generator there,
right.
And we call it non-specific low back pain.
Does that mean it can't be
Diagnosed.
surgically fixed? Or
Correct.
Right.
Yeah, that is absolutely not a
gonna go to
surgical.
surgery.
Correct.
Colin in Anne Arundel County. Colin, thanks for the call. Go ahead.
Hi, I'm 79 years old, and I had 2 lots of back surgery, and they were both successful. One I left too early. That was the first one, and I had permanent nerve damage. So I would encourage people to not do what I did, which is go to chiropractors and mess around before getting to a neurosurgeon. But both my surgeries have worked out very well.
What do you mean, sir, that you left too early?
Well, I was scared. I was scared of the surgery. This was 40 years ago, when I was a lot younger. And so I was dreading it because I thought that, okay, there was a chance I'd be disabled for life if it didn't work out well. So I kept putting things off until it got so bad that I couldn't sleep on a bed. I'd have to kneel by the side of the bed and to avoid the pain. But then at one point the pain went away, but then I realized that my right leg was numb.
Wow.
And I realized that was time to really do something.
Yeah.
So
we thank you for the phone call.
Oh, but I'd just like to say about lifting snow. The shovels that are sold, they're not designed for lifting snow. They're designed for pushing snow. And they're far too big. And they're just not designed for doing it. And so people use them for picking up snow and tossing it, and that's just not the way to do it.
That's a great point. Thank you so much for the phone call.
Just one other very quick thing.
Short on time.
After shoveling, what I found is, I know I've probably done too much, but I found if you take a very hot shower right on your lower back and drink 2 beers for relaxation.
There you go. Colin, we got to run.
Well.
Thank you for the phone call. Interesting advice there, but interesting perspective on the surgery. And a lot of fear before somebody experiences that.
Absolutely. I think that's completely normal. And people can wait too long. They can develop neurologic problems like Colin is describing, where we try to intervene and we try to make people better. That's our best intention. And we just can't get them to the point where their quality of life is significantly affected. And it's hard to predict. That's the reality.
Is it less risky, more effective, more consistent than it was 14 years ago? And
I think compared to where we were 14 years ago, 20 years ago, I think spine surgery, when well done by people that do it all the time, is a very safe, effective modality.
Very good. Dr. Stephen Ludwig, Professor of Orthopedics, University of Maryland, thanks for your time.
Thank you for having me.
Now, a program note. Next Monday night at 9 o'clock, tune in for a new MPT documentary on the life of former Governor Marvin Mandel. Here's a preview.
Governor, how do you feel with this phalanx of guards around you? Do you think you need all these?
I don't need them. If you all would just leave us alone, we wouldn't have any need for them.
It's been almost 4 decades since a scandal that shook Maryland politics. And still, this story leaves questions.
This is the first formal acknowledgement that I have received throughout these long months that I am in any way involved in any investigation.
Why, despite the charges, did Marvin Mandel remain widely admired for his work as governor? And did he deserve the humbling trip from the governor's mansion to a federal prison?
I'm not walking out feeling that I have done anything to hurt the people of this state.
This would have made a great movie. A lot of it would be hard to believe if it hadn't actually happened.
So these are a couple girls on the town, and they're at the Maryland Inn, and they run into Marvin. As he says it, it was just love at first sight.
Governor, what about your divorce? Can you say anything about that at all?
I can say one thing, I have no comment.
I've made mistakes, he's made mistakes, but we want to remember the people for the good things they've done.
He was a reformer. He brought about a much more streamlined government. He believed in trying to get government to work more efficiently. He believed in government, but he's probably going to be remembered most for his mistakes. And that, unfortunately, is the fortune of history.
Marvin Mandel, A Complicated Life, airs next Monday night, the 24th, 9 o'clock, right here on MPT. We're back Thursday with Your Money in Business. For all of us at MPT, have a good night.
This program was made by MPT to serve all of our diverse communities.
Tonight on MPT.